Hello, I'm Dr. Camran Nezhat, the founder of the Worldwide Endomarch and the Worldwide Endometriosis Day. I welcome all the viewers and I give my greatest greetings to all of you. Worldwide Endomarch is very thankful to all of its chapters around the world and in more than 60 countries for their significant contribution and calling to arms and responding to raising awareness more and more on a daily basis about endometriosis. Since its inception, all of you have been fantastic. Every time, every day, in the news media, you see more articles about endometriosis and hopefully more involvement of the government, more funding that would lead to more research and finding a method to prevent endometriosis, a method to diagnose it earlier, and a method to cure it. More medical societies are advocating or giving time to endometriosis. Example of it is International Society of Gynecologists and Endoscopy in the month of March devotes one session all about endometriosis, and it is open to all the public. So we thank you very, very much for your contribution and your interest to help young girls and women with endometriosis. The session today is about a lot of misunderstanding and myth about endometriosis. Many of these misunderstandings have been in the cultures around the world for years. We have an excellent panel that are going to address that, which includes Dr. Azadeh Nezhat, Dr. Ceana Nezhat, and Dr. Joelle Osias. And we have another great panel of the patients and advocates that they are going to tell their stories about what has happened with their life and the misunderstanding and myth about their life that we are going to address those. That includes Ms. Tiffany Letosky, Ms. Carla Cressy, Dr. Stacey Holz, and Ms. Cristina Del Valle. So I welcome all of you again. And as we said, Worldwide Endomarch is a philanthropic organization. We participate and we appreciate and we welcome all of your participation in any way you want. There are many, many webinars that we have addressed past issues like endometriosis of the bowel, bladder, ureter, diaphragm, pain, back pain, infertility and endometriosis, and ovarian cysts and endometriosis and endometriomas. All of them are available and has been discussed by excellent panel, and you will see their view. In this session, we also appreciate, we acknowledge Dr. Farr Nezhat, who is having another assignment and couldn't be here. And also we appreciate our other co-founder, Miss Barbara Page. We thank all the assistance that headquarters of the Worldwide Endomarch is giving, including Zoe Pennington, Sean Stetner, and the rest of the physicians of the headquarters, Ms. Shruti Agrawal, and Janelle Jackman, and Melanie Salem, and Genesis. Thank you very much for your participation. And we will start with Dr. Azadeh Nezhat, who is an endometriosis specialist, and her main interest is endometriosis in adolescent and teenagers. Dr. Azadeh Nezhat, please go ahead.
Good morning, everyone. I hope everyone's doing well. I was going to talk today about the some of the myths about endometriosis. The first one was going to be there is a cure for endometriosis, a curable disease, but unfortunately, that is not correct. We only have, at this point, we only have treatments that helps the pain or symptoms of endometriosis. The other myth that I was going to talk about, it is that hysterectomy cures endometriosis. That is also incorrect. We know that only hysterectomy helps the symptoms of adenomyosis, which is endometriosis into the muscle of the, growing into the muscle of the uterus. You know, that if you do hysterectomy, which is the removal of uterus and cervix, it helps the symptoms of adenomyosis, which is bleeding and cramping with the menstrual cycle. The other misconception is I hear it all the time that people talk about having total hysterectomy, and they would think that total had a total hysterectomy affects their ovarian hormones and puts them into menopause. That is also incorrect. Total hysterectomy means removal of the uterus and cervix. When we talk about, as physicians, about total hysterectomy is just removal of the uterus and cervix. When the removal of the ovaries and the fallopian tube are talked about, that's when the hormones are affected. So when you remove the ovaries and the tube, it's called bilateral, whether it's the both ovaries and the fallopian tube is bilateral oophorectomy, and then bilateral salpingectomy means that removal of the both fallopian, whether it's unilateral versus bilateral is removal of the fallopian tubes is salpingectomy. So those are some of the misunderstanding or misconception. So to kind of wrap it up is when we talk about hysterectomy cure for endometriosis, unfortunately, there is no cure for endometriosis. At this time, there are only certain type of treatments, and hysterectomy does not cure endometriosis. That's another misunderstanding. Only particular type of endometriosis, which is the adenomyosis, those symptoms are when you remove the uterus, obviously, you would not have heavy bleeding and cramping with your periods, and has nothing to do to treat endometriosis at that time. You should, there is always the removal of the removal of the lesions or endometriotic lesions that is over, whether it's over the ovaries or anywhere else in the pelvis. Those are also considered treatments for it, not necessarily definite cure for it. Another misunderstanding is that if you get pregnant, it would cure the endometriosis, which that is incorrect. When you're pregnant, the symptoms of the endometriosis would
All right, well, it seemed like we had a little bit of problem with the dog. That's no problem. So as Dr. Ozzy was addressing the issues of the pregnancy is a cure for endometriosis, exactly correct. When you are pregnant, it is not a cure. Pregnancy doesn't cure endometriosis. Only symptoms disappear at that time, but the lesions of endometriosis stay there. Endometriosis, we have to remove it. And when we remove it, it doesn't mean it is cured. It could reoccur. Okay, Dr. Azadeh Nezhat is back. Now the
I
dog
apologize, bad timing as far as the postman coming to the door. So I was talking about, I'm sorry for interrupting you, Dr. Camran. So basically, there's only treatment for endometriosis. The hysterectomy does not cure, it's not the cure for endometriosis. Because as long as you have the ovaries and the fallopian tubes and stuff, there's a possibility that the lesions that remain inside of in the pelvis, anywhere they were existing before the hysterectomy, they would cause pain and they will cause discomfort on the other symptoms that is associated with endometriosis. I was talking about does pregnancy cure endometriosis? It does not. We know that while women are pregnant, their symptoms of endometriosis are reduced, but and while they're not, because the hormonal changes that is caused by pregnancy would affect the activation of those lesions in the pelvis. But once the baby is delivered, and once the cycles are resumed, the endometriosis and most likely the symptoms of endometriosis would return. I think there are many other myths that is I see on the internet, but I only have 5 minutes, so I'll hand it over to Dr. Camran, and if their other panel is not addressing them, I'd be happy to talk about the does herbs cure the ovarian cysts, or excision versus ablation? What is the difference and which one is better, and how does it affect the symptoms of the endometriosis?
Thank you very much, Dr. Azadeh Nezhat. That was a wonderful start. Great. Now we will proceed with other myths that endometriosis does not affect the, only affects the white professional women. And we have Dr. Joelle Osias, who is an endometriosis specialist. Also, she has had background on training in endometriosis, and also herbal therapy, and also diets, and different methods of alternative therapies. And we welcome Dr. Osias, who has been a long persisting panel of the Worldwide Endometriosis March and Endomarch, and with background training in Tufts, Johns Hopkins, Stanford, and etc. in her training. Go ahead, Dr. Osias, welcome.
Oh, hi, Dr. Nezhat. Can you hear me?
Very well.
Can you hear me? Okay,
yes,
perfect. All right, thank you so much for this opportunity. Okay, thank you. Yeah, thank you for the opportunity to talk about addressing some of the myths about endometriosis. I think Dr. Azadeh did an excellent introduction about some of the misconceptions that a lot of patients have about endometriosis. Some of the things that we've encountered is some disparities in the diagnosis of endometriosis, particularly in women from different ethnic and socioeconomic backgrounds. As you've alluded to, there is a perception that endometriosis is a disease that affects affluent Caucasian women, but that is not the case. I think, unfortunately, endometriosis does not discriminate, and it does not impact a particular ethnic group or a particular socioeconomic status. So all women are vulnerable to the symptoms of endometriosis, and women from Afro-American backgrounds or Hispanic women can also suffer from endometriosis. But the challenge that they experience is the lack of sometimes access to care, or the tendency to have their symptoms be dismissed and not properly addressed. So that can cause a delay in diagnosis and a delay in treatment. Dr. Nezhat has often taught us that there's often a very long delay between the patients experiencing symptoms and getting their disease diagnosed, to be as long as 7 to 10 years. So that means a lot of women suffer unnecessarily and do not get the help that they need. So that's a big issue for women who are seeking to enjoy a normal quality of life, or to have their symptoms properly addressed. In terms of getting the diagnosis, one of the main symptoms that women have is, as Dr. Ozzy mentioned, heavy bleeding. That's often due to the endometriosis involving the uterine wall. And as she mentioned, that is treated effectively through hysterectomy. But unfortunately, endometriosis is not limited to the pelvis. So people oftentimes think that endometriosis is only a disease of the pelvic organs. So we think about the uterus or the ovaries or the pelvic abdominal cavity. Unfortunately, endometriosis can affect many different organs, like even the lungs, the diaphragm, the brain, anywhere where the blood vessels travel, the endometriosis can implant itself. But you're right in the sense that endometriosis is primarily affects the pelvic organs and the abdominal cavity, but it's not limited to those areas. And then endometriosis, often people perceive that it's only about pain. So the hallmark of endometriosis is painful periods, but the pain can occur outside menses. So people can have pain during intercourse. They can have pain that radiates to the rectum, pain that also radiates down to their legs, back pain. So pain is definitely a very common feature of endometriosis, but it's not the only symptom that can occur. And there are many women that have severe endometriosis and don't have pain. So pain, unfortunately, is common, but it's not the only defining symptom of endometriosis. And I think of endometriosis as the great masquerader, because oftentimes it presents in some enigmatic ways, and it's very important for the physician and for the patient to have a high index of suspicion, so that they can remember to do a thorough evaluation to make sure that they don't miss the diagnosis. So for women who are experiencing symptoms, I think part of the purpose of Dr. Nezhat's Worldwide Endo March is education and empowering women, so that they know more about their own physiology, so that they can know how to address their concerns to the right professional, so that they can get the help that they need. Because there are some biases, both on the side of physicians, and also for oftentimes women don't feel strong enough to advocate for themselves to make sure they get the help that they need. The other big issue that women encounter is being told that it's all in their head, and that they should just bear it, and that they're being hysterical. And so I always reassure patients that it's never normal to suffer from your menses, and that if you're having persistent symptoms, that they should continue to ask for. And if you're have to fire her and get someone who's going to be listening to you and be willing to take your symptoms seriously and do the appropriate workup. The last 2 minutes I wanted to address is the perception that endometriosis is always improves with menopause. Although it's true that menopause can alleviate the symptoms of endometriosis, but it's not always the case. Because as you may already know, endometriosis is a hormone-dependent condition, so that the presence of estrogen is more likely to cause the symptoms to be exacerbated. And so oftentimes people may experience a relief of their symptoms after menopause, but that is not always the case. So the importance here is for being vigilant about making sure that if you're experiencing pain, experiencing symptoms, that you address your concerns to the appropriate provider. And if that provider is not adequately trained or doesn't listen, to make sure that you continue to search for the right person. I think the benefit of the internet is that it's empowering us as women to look for the right help, look for physicians like Drs. Nezhat, who've devoted their entire lives to making sure that women's voices are heard, and that they know that we are here to help, and that we're committed to helping them get better. Lastly, we talked about the idea that that pregnancy cures endometriosis. Dr. Azadeh Nezhat already addressed that the pregnancy just masks the symptoms, but that the symptoms are likely to recur after a woman delivers, because the hormonal changes are gonna resolve, and with the disruptions of menstrual cycles, the pains is likely to come again. Some patients ask me about the use of supplements to help with pain or help with ovarian cysts. There aren't any supplements that are going to help ovarian cysts per se, especially endometriomas. There have been in the literature back in the 50s, some report about using iodine for simple cysts, but I don't think it's likely to help women with endometriomas, which are what we call them complex cysts, because they're not as they have more, we call it cellular debris, and they're not simple. And so for those patients, I don't think that iodine is going to help per se. I do think that diet plays a role in lowering inflammation. So for my patients with endometriosis, I do recommend a healthy lifestyle, avoiding sort of genetically modified foods, and making sure that they avoid things that are going to create more inflammation, because that's going to worsen the pain. So I think that endometriosis is a very important issue that affects a lot of women throughout the world. And I'm so grateful for Drs. Nezhat for the work that they've done throughout their lives to make sure that this condition is properly recognized and properly addressed, and that we as physicians become more sensitive to the needs of our patients, and as well as that patients are also informed about the availability of expertise throughout the world to be able to address their needs and make sure that they enjoy the best possible quality of life. So that finishes my section.
Well, I thank you very much, Dr. Osias. That was fantastic, as usual. Now we proceed with Dr. Ceana Nezhat, the co-founder of the Worldwide Endo March, that he is going to address some other of the myths and misunderstandings about endometriosis.
Thank you very much. I'm Ceana Nezhat from Atlanta, Georgia, and my greetings to all of you around the world. One thing I like to supplement to Dr. Azadeh Nezhat and Dr. Osias is about a better understanding about endometriosis. We think endometriosis is one disease. It is not. We have different variation and different manifestation of endometriosis. There are subtypes, like we have diabetes, different diabetes, or better compare it is different type of, for example, ovarian cancer. Endometriosis could be infiltrative. Endometriosis could be scattered or localized. Endometriosis could be superficial, or it has different manifestation like typical, atypical. And also, when we talk about the pattern of the function of endometriosis, it could be progressive, it could be inflammatory, it could be infiltrative. So having said in the background, I would like to supplement to the two previous speakers about, for example, pregnancy could cure endometriosis. Pregnancies could not cure endometriosis, but in certain cases could slow or stop the progress of the disease. So instead of being progressive or infiltrative, it could stop it. That's why we use certain medication to create a pseudo-pregnancy. On the other hand, like menopause, they say menopause stops the hormones, so it could cure endometriosis. It does not, but it could slow down the process. So this is the one thing I like to address. The second one is endometriosis, adenomyosis, and a type of hysterectomy. For many years, since early 90s, we have advocated that patients who have deep infiltrative endometriosis and severe pain involving the vaginal, rectovaginal area, and the cervix, it is not good idea to leave the cervix behind unless surgical safety indicates. So supracervical hysterectomy or subtotal hysterectomy for infiltrative endometriosis and pain and adenomyosis causing bleeding would not completely take care of the problem. It is better to remove the entire disease along with the cervix. I supplement what Dr. Azadeh Nezhat and Dr. Osias said. Hysterectomy just removes the uterus. If a person has endometriosis on the diaphragm or on the side walls or on the intestines, they remain the same. They require their own treatment. So in our patients, even if they want to have a hysterectomy, we advocate first treat pelvis and extrapelvic endometriosis, and then do the hysterectomy for a long-term better results. Thank you for the opportunity.
Thank you very much, Dr. Ceana Nezhat. You notice all the presenters that the myth about endometriosis, some other myth that it is very important to address is not always patients who have endometriosis have pain. A major portion of the patients with endometriosis have no pain at all. Why does endometriosis cause pain sometimes and sometimes it doesn't? That is an enigma to a large degree, but it could be explained. I often explain for my students and fellows, endometriosis is like a piece of sand in your eye or a rock in your shoe. If the rock is in your shoe and the sand is in your eye, it causes a lot of pain. But if the sand is in your pocket or the rock is in your backpack, you might not even notice it at all because it is not sitting near a nerve. When the endometriosis is sitting on a nerve and causes inflammation, that is why it is causing pain. That is one reason. So endometriosis doesn't always cause pain. And actually, a lot of times there are couples that they are trying to have a child and the husband is completely okay, the wife or the partner, the female partner is completely fine, all the tests are normal, they don't get pregnant. In our experience, the majority of these people, more than 90% in our hands, in our practice, have endometriosis. So couple who try to have children and they don't have children and everything is normal, it is not normal. That could be endometriosis, and the endometriosis could have no symptom. That is very important to address. So saying all of that, there are some other myths that we are going to address. And I would start with our first speaker, Tiffany Letosky, that she is going to address all of the discrepancies that she has noticed as a patient over the years when she has been dealing with endometriosis. Tiffany, please go ahead.
Hi, Zoe, can you just take my video off? It's not letting me add my video back. Thanks. Sorry about that. Hi, thank you so much for letting me share my story. So, first of all, thank you all of you for addressing all of these issues for us women and, you know, people with endometriosis out there, and just debunking these myths that, you know, a lot of us, I am an advocate for endometriosis. I work with Dr. Farr Nezhat, for those of you who don't know me, and I also help out with everyone else here in the Endometriosis Worldwide Endo March and the Nezhat Family Foundation. I help out a little bit getting these things set up. And one of the things as an advocate, these myths are constantly being asked, even as just working with Dr. Farr in the office. I see a lot of these questions constantly. Patients come in with these. So just thank you all so much for doing this today, because it's really important issues that, you know, everybody really needs to hear the correct answers to. So I appreciate that. But my story that I just wanted to share was I have endometriosis, and I started suffering at a very, very young age. I actually started feeling sick a lot before I even got my period, like around the time that I was starting to, I guess, go through the hormones were changing. And at that time, I have a few women in my family. It's actually pretty prominent in my family. There are a lot of women in my family, unfortunately, that have endometriosis. So I was one of the few that as a young teenager actually knew what it was, because I'd seen relatives that have had it. So it was something that was mentioned to me very young when I started having a lot of the symptoms of a lot of, constant pain all the time. I was fainting a lot, all of those things, that go hand in hand with the heavy bleeding. I was missing a lot of school. So my mom actually took me to the doctors pretty young, right after I got my period when I was 12, shortly after, sometime in that 12 to 13 year. And unfortunately, I was told at that time, even though we have family members that have had it and very young that have had it, that hadn't had children, I was told that as a Latina young woman, that I needed to worry more about getting pregnant, because typically Latinas are very fertile, and that I shouldn't even be worrying about endometriosis, because this is something that happens to women much later in life after they haven't had children, and that maybe later on in life decide to try to have children like in their 40s, and that I was way too young to be worrying about this, and it's not something that I could possibly even have. So that was initially immediately how it was brushed off. So not only was I completely judged just for being a Latina girl, I was not sexually active at all at the time. I was very young, and they basically made it like they put me on birth control right away and said, this is something you need to worry about. You need to go on birth control. And over the course of the next several years, I had a lot of cysts that ruptured. I had a lot of stuff going on. I was in and out of the emergency room. All the way back then, it already started that I was in and out of the ER. And they basically just treated me every single time saying, you just should have pelvic inflammatory disease. Let's just check for STDs. Are you sure? Like, how many partners have you been with? And just really stress the fact every time that I went that it was like a sexually transmitted disease that was causing my pain, that was causing all of these different issues that I was having. And again, much of the time prior to this, I was not even sexually active at all. And they just, made it like, this is just something, this is what's causing it. And I didn't really think much of it at the time because I was so young, but now obviously as a woman and looking back on all of it, that really impacted me in it. It took a toll negatively on my mental health as well, because they were telling me, basically, you're going to have no problem getting pregnant and you don't need to worry about this. Come to us when you're 40 if you're still having issues, blah blah blah. And fast forward to after I had a few surgeries, because I actually wasn't diagnosed properly with endometriosis till my third laparoscopy. The first two, they said I just had scar tissue and they said I don't have endometriosis, but the third one, they finally found it. And after my third one, they said, now I was in my early 20s, after all these years of being told birth control is going to fix it, if any problems you have, and you'll get pregnant and it'll go away if you have any problems. Now I was told after all that, you're never going to be able to have kids. And I was told, you've had 3 surgeries already and you're 22 years old. It's not going to happen for you. So it was like the flip flop from one extreme to the other that really, impacted my mental health a lot at that time, because I didn't know what to think. I didn't know what to do. I felt like I wasn't being helped, in any way, which many of us, with endometriosis feel, unfortunately. That's why I'm so thankful for all the doctors like you that are out there helping us and getting the right education out there. But, this is something that's a common misconception. And this was many years ago now. We're talking like 20 years ago, but doctors are still thinking that way. Still now, I have, we have patients come to us and tell us that they said, oh, if I got pregnant, it would go away. And for me personally, I did get pregnant. I'm happy to say I was not infertile, and I did get pregnant, and my endometriosis got worse after I had children, like a lot worse. So, this is just one of those myths that really needs to be, knocked out of the park, and they need to really get the correct information out there.
Thank you very much, Tiffany. That is a fantastic story that you said. And, unfortunately, as Tiffany said, it's still to this day, we see patients that adolescent girls, teenagers, they come and they say, I have seen so many physicians, and they say, oh, don't worry about it. It is something you are imagining it. Your ultrasound is negative. Your colonoscopy is negative. Your upper GI is negative. All of your MRIs are negative. You don't have anything. And are you sexually active? And perhaps this is sexually transmitted disease. She said that she is not even sexually active. When they say, well, you have irritable bowel syndrome. Well, it is not irritable bowel syndrome. And then if they continue, but you need some antidepressant. So Tiffany is absolutely correct. Unfortunately, it still continues. And thanks to all of you around the world with Endomarch and other endometriosis organizations that you are trying to educate and debunk that this is not correct. It is not in your head. It is not hysteria. And unfortunately, Freud made it worse for women, that they call it hysteric women. So pain is not normal. And if you have pain, it should be evaluated. And if you are not able to get pregnant and everything is normal, you don't have pain, that could be endometriosis. Endometriosis is multifaceted, should be taught everywhere, and in the medical schools, in different disciplines, all the organs could be involved. And we do not want women and their families, their mothers, their fathers, their husbands, their wives, their children to suffer. So that is, we appreciate your education, Tiffany, and your work. Another person who has suffered a lot because of the same concept is our next speaker, and that is Ms. Carla Cressy. She is in England, and Tiffany was in New York, and Dr. Osias was in Dubai. All of our speakers from internationally that are speaking. Carla, we would welcome you. Thank you for staying, for sharing your story. And please go ahead and explain your travel or journey with endometriosis and your the misconceptions about what happened to you.
So my story is a little similar to Tiffany's in the beginning, where my symptoms started really early on. I think I was 13 when I first started going to the doctor. My periods, they were just really irregular, terribly painful. So when I was 14, I was put on my first pill. And by the time I was 17, I tried, I think, 6 or 7 different birth control pills, but nothing helped. And I would just bleed all the time. I would collapse in pain. I had migraines. I was always fainting and taking time out of school. So things just progressed. And I remember I'd keep a diary. I'd always keep a period diary, and I'd write down all the days that I bleed. And there was one time I bled straight for about 60 days. And I just remember my doctors quizzing me, like they didn't believe me. So yeah, I had quite a battle with the doctors. But then once I turned kind of 2021, that's when things started to really progress, and I was being taken to and from the hospital a lot, sometimes 3-4 times a week by ambulance. And they would kind of suggest pelvic inflammatory disease, IBS, sleepy bowel syndrome, because I had a lot of bowel symptoms. Again, I would just be given pain relief and sent home. And it got to the point when I was kind of around 23, where my bowel would just stop working, and I would go 2-3 weeks where I couldn't physically go to the toilet. And my periods were so awful that I I lost my job because I was just passing out all the time in pain. And I was just in the hospital more than I was at home. And that's when a doctor kind of said to me, oh, I think you might have endometriosis. So I went into surgery and they diagnosed me with stage 2, but they had done ablation. So after that surgery, nothing got better. My symptoms kind of come back even worse. So I was back and forward to my GP again, saying, you know, something's not right, it's not helped, things are getting worse. And I just kind of had to persevere with it. And then 6 months after that surgery, I was rushed into hospital again with suspected appendicitis. At first, they thought it was gastroenteritis and sent me home. And then the following morning, I was taken back into hospital again. And they rushed me into surgery and removed my appendix. And a few days later, I was still in the hospital and I was getting worse. My infection the markers were through the roof. And I just wasn't getting better. I was really, really poorly. Couldn't stop being sick. So I had the drains and everything, and it was horrible. So they rushed me back into theatre again. And this time they cut me from hip to hip and they drained a lot of blood from my pelvis. And they said that they described that it looked as though someone had kind of opened me up and poured cement into my pelvis, that there was just scar tissue everywhere. And that's when I was diagnosed with frozen pelvis and stage 4 endometriosis. So from then, I spent a good few weeks in the hospital just getting better. And then I was sent to a specialist hospital who done loads of MRIs and scans. And luckily for me, my endometriosis showed up on the MRIs, and even the physical exams, they could feel the nodules, and it had kind of invaded my cervix and my intestine and everywhere. So I then went on to have more surgery, and that was just to kind of look around and plan for an even bigger surgery, which I had October last year. And the endometriosis had just progressed and it invaded my intestine, everything. So I had to have a pelvic clearance. So they removed my cervix, my uterus, my ovaries, fallopian tubes, and part of my bowel. So I now have a colostomy bag and full hysterectomy.
But thank you very much, Carla, for sharing your story. And we are sorry about all what you have gone through. And thank you for your encouragement and for trying to spread the word for the benefit of other patients and people. So as you can see, endometriosis is not only a disease of reproductive organs, and endometriosis could affect all the organs, including bowel, bladder, ureter, diaphragm, and sometimes, unfortunately, a patient could be involved with all of them. And that is another one of the goals of the Worldwide Endomarch, to encourage more education of endomarch in the medical schools across the world. And this is happening. I'm happy to report to you again, more and more societies are getting involved in teaching endometriosis. As you know, Society of Laparoscopic and Robotic Surgeons was the first society who started teaching and training endometriosis specialists 5 years ago, and we have been training endometriosis specifically specialists for the past 5 years in our training program. And that brings me to the next speaker, Dr. Stacey Holz, that she is going to share with you her story and the misunderstanding about endometriosis that she was confronted with and had to deal with. Stacey?
Thank you, Dr. Nezhat. Thanks for this opportunity. I think that my story, often many of our stories have a common thread. And for me, I would say I could sum that up with the word enigma, that endometriosis has been an enigma for myself as well as to many of the doctors along the way before meeting Dr. Nezhat and Dr. Azadeh before that, which helped me on my journey. So I would probably say I first heard the word endometriosis in my 20s when I had periods and throughout my adolescence. I was actually a distance runner in high school and college. So I would have painful, irregular periods, go sometimes 8, 9 months without a period, and also have periods that were what I would term crime scene periods. They were very heavy and severe. I had anemia during my collegiate career and sometimes in high school, but the doctors would just dismiss it as, oh, you're a distance runner. So I'm not sure if that was the cover up, but I think that I just went along with that at first because it was an enigma to me, and I just thought, okay, I guess that makes sense, and fueled on. And then as time went by, and certainly as I was in my 20s, I started to have more symptoms, and maybe it wasn't because I wasn't as heavily distance running, but also I started to have a lot of bowel issues. And something that hadn't been present when I was much younger. And I actually, by the time I remember right before I married my husband, and when we were dating, there would be times we'd go out on a date and I could barely make it home before I would be having awful bowel symptoms, whether it be diarrhea, severe cramping, like someone was kicking you. And right before our wedding, I actually had to go to the ER. And I had an emergency, if you will, colonoscopy and upper GI scope. And this was not in my early 20s. By now, it's probably mid to later 20s. But this journey had been where the doctors would just dismiss, oh, you had amenorrhea or you missed periods because you're running. We're going to have you take birth control pills to try to manage this. And then with that ER visit and the consequential colonoscopy, the doctors, and there were many after that, that would say, oh, well, you seem like you have ulcerative colitis, but your biopsies were pretty normal, but we still think you have ulcerative colitis or some variant of that. So I continued through the decades, if you will, while concurrently not distance running always, but later distance mountain biking, I would concurrently have a physical journey through this. And I had pain, but I guess I would say it was the analogy of like any endurance race or ride. I had pain, but I didn't know what I had until it was gone, which is more recently in the journey. It's not gone forever or gone for sure, but what I mean by that is kind of weaved into this fabric of being dismissed by doctors. And when I would inquire, could this be endometriosis? And I have to admit, I wasn't a good study up on this since I was learning other species, all the other mammals with tails. I was not as apt to. I would advocate for myself, but I didn't learn this subject matter well. And so if I asked a question of a doctor, oh, could this relate to endometriosis? Because it didn't just happen with periods. It didn't just happen. It was a constant draining, not something that, I mean, I still was able to carry on with a career. That there were times I would obviously have pain. It was debilitating, but it was definitely something where the lifestyle choices I was making to be fit and have better races, clean eating and exercise, those endorphins helped a lot. So that helped me get through that. But I think the main misconception that I had and that the doctors had until meeting doctors that listened to me is just dismissing that there's no way that could be endometriosis. And I unfortunately usually accepted that sometimes, or just, on to the next colonoscopy. And then as far as the journey more recently, that wound through some decades there. It did seem to have progressively worse symptoms, but I was still chronically taking the birth control pill. And when my husband and I have been trying to conceive, that's something where we actually, when I was not taking, obviously, the birth control pill, I did have some more symptoms, but I think it really became more recognizable when I had an endometrial biopsy or receptiva test that showed that it was a very high score. And it kind of was a wake-up call for me that I needed to, and thank you to my doctor, Dr. Azadeh, who did that, because it was something where it then enabled me to find answers, and it enabled me to have, I did go through some medical treatment like Depo-Lupron, which I always joke is from the devil, but the medical treatment of that, and then more recently surgery with Dr. Nezhat. And I feel a lot better. During surgery, there was endometriosis of the bowel. Go figure, right? So it was likely, I anticipated, and I think Dr. Nezhat would echo it, it may have been there for decades, as far as the adhesions and the severity. And so it was something that I hope that just sharing this, and I hope that continuing onward, all of us can increase the awareness, because for me, it was basically this naive college kid, if you will, then winding throughout life and not realizing that the pain that I had from, whether it be my back, my bowel, my pain with going to the bathroom, if you will, I always thought, oh, maybe I just overdid that workout, or that was because I did that 12-hour race. Just, you know, the misconceptions, and it's something that once some of that pain has been removed, it's just an amazing experience to like have your life back. And I think even more so it was to have Dr. Nezhat listen and say that it wasn't in my head, that this was something that had been there. He had the scientific evidence. And so it's something that if more people can have help sooner, and we can increase the awareness, I think that's going to obviously benefit so many women worldwide. So thank you.
Thank you very much, Dr. Devel. That is the story, again, here important, that we would like to thank all of you from around the world who are trying to help raise awareness about endometriosis, because we need to help young girls and women from the early age. Dr. Devel's story, and Tiffany and Carla, they didn't, and Stacey, they didn't start it. It took 10 years to 15 years that they to be diagnosed, and that's not fair. Imagine in the good world, if everybody's condition is diagnosed very early. Yes, even now we cannot treat them and cure them completely, but at least we can use some measures that women, young girls, they don't suffer so much and they don't get compromised with their reproductive organs. And that is when there is pain. Imagine those who have no pain, no issues at all. As I said, the story of the sand on your eye or the rock in your shoe. So if we have a method to suppress the disease on the ovaries, that it doesn't destroy the ovaries ideally, or find a method that this young girl might have endometriosis, so if it is possible, she could freeze her eggs. These are methods that we have to work on and eliminate the myth. But by yard is hard, by inch is a cinch. Step by step, we can educate and progress and get things better and better. Especially again, endometriosis doesn't always cause infertility. Some women get pregnant with endometriosis very easily. Why? Some people have no pain at all, and they don't get pregnant and they are infertile. Those couples who do not get pregnant and all of their tests are normal, the majority of them are having endometriosis, and they should be evaluated. And that is a myth that endometriosis always causes pain. It doesn't. And that's bringing me to the next guest, Cristina Del Valle. And again, I would like to thank Christina. And I think I mentioned Dr. Stacey Holz, how she addressed the issue of the bowel endometriosis. And now we will proceed with Christina. Christina, welcome, and please go ahead.
Hi. So I'll very similarly to a lot of the other people who experienced endometriosis, my symptoms started when I was pretty young. I was 15 when I first started having to call out from school because the pain would get so bad. I would sometimes have to go to the bathroom and throw up, like during class. So the first time that happened, my mom came home to take care of me. And I was in a bit of a unique position because my mom had endometriosis. So she recognized the signs of that and was like, you probably have endometriosis, but that was pretty much the end of the conversation. She's not a medical professional, so she's not too knowledgeable about what the actual disease is. She basically just told me it just causes really bad periods and that's it. And so we never really went to a gynecologist or did anything about it. When I needed to go home from school, she was really, really understanding of that and let me come home. But that was pretty much like, you know, I was given a heating pad and some ibuprofen and water, and that was pretty much the end of the care. And then the period would pass and I would just go back to my normal life. When I was 18, I started becoming more sexually active. So I started seeing a gynecologist every 6 months. And I remember like always bringing up that I had, at this point, they were becoming extremely painful to the point where I couldn't like get out of bed sometimes when I had periods because it hurt too much to walk. So I was starting to talk to my gynecologist and trying to ask them, is this normal? Like, this doesn't feel normal. And they would always tell me, yeah, you're fine. Your pap smears came back fine, which is another huge myth. A lot of people think that you can find endometriosis in a pap smear, but it doesn't, to my knowledge, it doesn't show up in a pap smear. It wouldn't. So my pap smears came back normal. My pelvic exams would come back normal. And I just thought, okay, I just have a low pain tolerance, I guess. And, my periods are just, painful and I'm just going to have to deal with that. And if I do have endometriosis, I still felt like I probably did, but every time I went to a doctor, they wouldn't listen to me. So I was like, okay, well, I guess, if all it is painful periods, I can just deal with that. It's like a week every month and it sucks, but it's manageable. Until it started not being manageable. And I didn't correlate this at the time because I didn't know that endometriosis could spread to pretty much anywhere in your body. But during this time, I started developing some really, really serious lower back issues. I went to physical therapy for them. I went to the doctor for them. No one really knew what was going on. But anyways, as you found later when you did my surgery, Dr. Nezhat, there was endometriosis in my spine. So it makes sense why I was having back issues. But yeah, basically I was with my friend Erica and I was on my period and I was, really not doing well. Like I usually wasn't on my period. It was hard to walk. I was like kind of just like limping around the house. And I started telling her about my symptoms and I was like, yeah, it's just a bad period though. I can deal with that. And that's when she sort of started educating me on exactly what endometriosis was. And she said, no, it's way worse than just a bad period. If you're lucky, all it is a bad period. It can spread pretty much anywhere in your body. It can take over your body. Like it could potentially collapse your lungs and kill you. And so I was like, okay, well, I didn't know that. And maybe it's time to start taking this more seriously, which is when you so graciously helped me and, screened me and did an ultrasound and basically told me there's pretty much a 98% chance that you need to have, that you do have endometriosis. And so I was in a really, really precarious living situation at the time. So I wasn't able to plan my surgery right away, but the months between getting confirmation that I potentially had endometriosis from you and actually scheduling my surgery were the worst they were the worst 4 to 5 months of my life it got to the point where it spread to my back. I couldn't even stand. I couldn't go to work. I lost my job because of it. You know, I couldn't even make it from my bedroom to the bathroom. My boyfriend had to like help me walk there. So I was like, okay, I'm miserable. I can't do anything. And this is really, I can't even live a normal life right now because, you know, I'm in so much pain. It's debilitating. I was throwing up all the time. Like it was a horrible, horrible experience. And then you did my surgery, which I'm so happy about. And, you know, the first thing you said after was the surgery was a huge success. And that was a huge relief for me. And then you told me all the different places that it spread in my body, which was, you know, it was all over my ovaries, all over my uterus, you know, it was on my spine, it was on my bladder, it was like everywhere. So it's crazy though, because leading up to that point, even though my symptoms were so like severe and I literally couldn't live my life normally, I was still scared up into the point that I had surgery. Even like right after the surgery until I talked to you, I still thought all of it was in my head because I think I'd just been told so many times, you know, you're normal, your past years are normal, you're fine. Up to the very last point, after my surgery, until you talked to me, I still thought it was in my head. I still thought I was just making things up for attention, which I obviously wasn't doing. So it's just crazy. And I think it's really, really important. I've started to like open up about my personal journey online and have received so many messages from people saying the same thing. Like all my doctors just say I'm fine and I don't know what to do because no one will listen to me. And it's just, it's really, really sad. And I think we really, really need to, you know, squash this idea that severe pain to the point where you're throwing up and passing out is normal on your periods. You know, I was in school, they would tell us like, that is normal. Like when I did sex ed in high school, they were like, yeah, sometimes, you know, you'll throw up and that's, you know, severe pain is normal. And it's really, really, it's not. So thank you so much for doing this and giving me an opportunity to speak. And I'm really, really grateful for this. But that's my story.
Thank you very much, Christina, and thank you for sharing your story. For those of you who didn't notice or noticed, Christina was referring to Erica. Erica is the friend of Christina, who is the Director of Education for the Worldwide Endomarch. And she's a medical student and our friends. And imagine she had a friend, Erica, who is a medical student and is a member of Worldwide Endomarch and is educated about endometriosis. So it took a while for her to convince Christina to go to a doctor because she has been told all along it is in her head, all is normal. Imagine those who do not have an Erica. Imagine those who have authorities telling them that it is normal. They don't mean badly. Those physicians, they mean well, they have good intentions. It is just not the best moment, unfortunately, because what the mind doesn't know, the eyes don't see. They are not aware. The same way it is not on their radar. And that is what you are all doing by this Worldwide Endomarch. And we are getting the next month. Next month, we are having, we could say, large celebrations for raising awareness for a 2-day period. It's going to be all virtual around the world. All the countries from Austria and Australia to Zimbabwe, they are all involved, A to Z, and everybody in between. And we thank you for helping yourself, for helping your children, helping the whole world as a result. There are some questions that we would like to answer. And I want to know if Dr. Farr, Dr. Ceana Nezhat, and Dr. Azadeh Nezhat have any, and also Dr. Osias, have anything to add? Please go ahead. If any of you want to add anything, go ahead and address it. If you don't, perhaps one of you, we could start with Dr. Ceana Nezhat. One of the questions is, does endo spread in the body in the same way as cancer? And the other, essentially, is how endometriosis spreads. Can it go spread all over, just like cancer, or what is the risk of endometriosis and cancer? That question would have been great for Dr. Farr Nezhat, who couldn't unfortunately participate because he had another commitment. But go ahead, Dr. Ceana Nezhat, please address that question.
But I like to compliment all the audience for being so interactive and sending so many good questions. Also, I'd like to compliment the panel for sharing their story. At the same time, I like to give good news to all the patients who have endometriosis. True, we have heard that their symptoms were brushed off. I published a paper about 20 years ago that by the time a teenager or an adolescent is diagnosed with endometriosis, it takes about 8 to 10 years, and they may have seen up to 12 doctors. So on that line, I realized there are more and more doctors getting aware. Today, we have more awareness not only amongst other doctors, amongst other healthcare providers who do understand endometriosis, and they don't tell the patient it's in your head, and they properly refer them to the appropriate center. We just published a book on adolescent endometriosis. It has never been addressed before. And in that book, I've had pediatricians, nutritionists, social therapists, psychologists write their experience, and it goes to all the disciplines. So true that the panel had a bad experience, but I'd like to share the good news that there is more awareness today amongst all the specialties, healthcare providers, that it was 2 years ago, 5 years ago, and exponentially 20 years ago. That's one thing I'd like to address. The other one, that how does the endometriosis spread, and could it be going the same direction as pattern of the cancer? Yes, that's the Simpson's theory, from the left to right. It could go from sometimes, or most of the time, we could see certain endometriosis more severe on the right than the left. At the same time, we could see endometriosis trapped between the sigmoid and the bowel and rectovaginal septum on the left. That is one theory, but on the book that I just mentioned, we have a chapter that diagnosis of endometriosis were done in the autopsy of the babies who did not survive, and they found endometriosis. So it could be a coelomic metaplasia and originating. And that brings me to my first comment, that we look at endometriosis as one entity. It is not. Endometriosis has a different variation, different manifestation. We even have types of endometriosis is reported as endosalpingiosis, endocervicosis. So please, what we need to focus is increase understanding about variation and manifestation of endometriosis. And one more thing I will comment, I saw one of the questions. She said she had excision of endometriosis and she has pain. For God's sake, this excision, and I like to challenge all the excisionists around the world, that they tell the patient excision is the only way to take care of endometriosis. and excision would cure your endometriosis. Please, this is misleading, this is misinforming, the same way that all these patients were told it is in your head. They are telling them, I do the excision and you should be free of endometriosis. I am on the verge of not calling it unethical. I am on the verge of calling it criminal. And the reason I say, I just saw a patient last week. She was told she had excision of endometriosis on her tubes. She was told she had perisacral neurectomy. I look at the pathology report of perisacral neurectomy. It shows fibroadipose tissue. The procedure was not done properly. I look at the pathology of the fallopian tube. It says muscle of, the tube, and it says removal of the muscles of the tubes. 21-year-old girl. Please, you as the audience, you as a participant, understand treatment is not distraction of the organs of the individual. Excision is misleading. Please forgive me for getting emotional, but I do see this happening every day. For the person who brings that question up, I had excision and I still have pain. You have endometriosis, it was improperly treated, or endometriosis was not the cause of your pain and it needs to be looked at. Does Marina going to take care of endometriosis? Not necessarily. All the new medicines that I see them being questioned on the question and answer, they may remedy the symptom, but they would not cure the endometriosis. And thank you very much for the opportunity.
Thank you very much, Dr. Ceana Nezhat. Excellent point. So, and I echo what Dr. Ceana Nezhat said, that there are a lot of good news. We want to let you know. On the positive side, if endometriosis is addressed by an specialist who is familiar with endometriosis, the prognosis for pain is excellent. It is not 100% of the time, but the majority of the patient, in excess of 85% of the patient with endometriosis, and they have pain, if they have addressed properly, they could have significant improvement in their pain, not 100%. Some endometriosis patients, unfortunately, no matter how well you treat their endometriosis, the pain continues. And that is an area that we have to address it even more. But the majority, in excess of 85%, close to 90% sometimes, you can see this patient, they benefit, they have a better life, and the glass is almost 85 to 90% full. The same goes for couples who want to get pregnant and they have endometriosis. The chance of success is significantly better, and we have published multiple papers with documentation that when endometriosis in infertile couple is treated properly by the proper surgeon, that they don't cause any harm, the chance of success is much, much better, 75 to 80, even further percent, comparing to 30% if they continue to go doing IVF without any treatment. But it has to be done properly by proper surgeon who are understanding the disease well. So there is a lot of good news for the patient. We want you to understand the good news is there. We are making progress. We are moving the mountain an inch. And by yard is hard, by inch is a cinch. We are making progress, and there is a lot of good things about endometriosis. As I mentioned, Worldwide Endomarch has an app that it is called Nezhat Endometriosis Advisor. That is a free app, free all over the world. If you take it, if you are suspicious of having endometriosis, for pain or infertility, it could at least guide you. It is not treating you, it is guiding you to see the proper people. Go to the website of the Worldwide Endomarch, download the app, give it to all of your friends. It saves them a lot of money. If you can afford it, you can give $1 or whatever to the Worldwide Endomarch to help them raise more awareness and participate. Participate. The good news is coming. Next month, the Worldwide Endomarch awareness is going to be 2 days from the headquarters. We are managing. We have good celebration. Please participate on that. And we thank all of you again for participation. We thank the Carla. We thank Stacey, Christina, and Tiffany, and Dr. Osias, Dr. Azadeh Nezhat, and Dr. Ceana Nezhat. And we thank all of you for your participation. And we look forward to seeing you. And we thank also the headquarters of the Endomarch. Thank you, and we wish you a great month until we see you next month. Bye-bye.